Okay, hi again. This is the second question in the internal medicine shelf review question sets. Now, this question is about a wait a second. Okay, it's about a older guy, let's say in the 60s, who comes to your ED, and this person has been having left-sided chest pain that radiates to the arm for 3 hours. You do your EKG, you draw your troponins, everything comes back as negative. You go back 10 minutes later, 20 minutes later, everything is fine. You go back again, everything is fine. The question is, what do you do now and what's going on? Okay. So you might be tempted to say, oh, I mean, we checked everything, the person's good. Maybe admit them and just make sure they're fine or send them home. Um, the answer you should be looking for is that you need to keep checking this person for a longer time because when you're having an MI, a lot of times the actual symptoms present themselves before the laboratory findings. Okay, so in this case, this guy in 4 hours might be showing actual symptoms. So you want to re-examine them every 20 minutes. Not re-examine, sorry. You want to repeat EKG and troponins every 20 minutes, not every couple of hours. It has to be frequent. Okay, and so let's say the person did have SC elevations or troponins or whatever. Using SC elevations and troponins, you can differentiate this patient into three different sub-diagnoses, right? An STMI, an STEMI, so SC elevation and MI, which will you have positive troponins and you'll have a positive SC elevation. You can have a non-STEMI in which you'll have a positive troponin but no ST elevation, or you can have unstable angina. Okay, these are kind of in a gradient. Worst being MI, worst being STEMI, and then non-STEMI, and then unstable angina. Okay, unstable angina, none of them will be positive. Okay, your EKG will be negative, your troponins will also be negative. Okay, you might have some EKG changes actually in unstable MI, but what you do from there is pretty much you have to give him all your anticoagulation. You give aspirin. Actually, as soon as you're doubting MI, you give aspirin. So you don't wait for the EKG or whatever. As soon as this patient walks in, you give him aspirin. But you give him aspirin, you give him your nitros, you give him your morphine, oxygen, heparin, you give him the statin. You try to anticoagulate, try to increase this person's survivability. Okay, and then answer after this as to what you do is most of the times you need to cath these patients. So you put a catheter in them, you actually perform angiography of the vessels, and then sometimes you do, if you can, you do a thrombectomy. And I don't know if you do a thrombectomy, but you basically put a coil in, and then after the coil, they have to be dual antiplatelet blocked. Okay. Another thing you can do if you're at a place that a catheter capable facility is more than 2 hours away from you, then the correct answer in that case is to give him TPA. Okay. So the thought behind that is that let's say I'm at a facility with a catheter capable facility closest to me being 3 hours away. I treating the patient right now with TPA by me is more effective than having them wait for 3 hours and get percutaneously, um, I guess, then getting catheterized. Okay. Um, let me think. Let me think. Let me think. Yeah, that's everything I want to say. Sometimes in a patient like this, technically the answer could be a stress test, but uh, definitely not in unstable angina and or STEMI. I wouldn't choose. Sorry, definitely not in non-STEMI or STEMI. I wouldn't choose uh, your stress tests. The only time that a stress test would make sense is that is if everything is negative and you just try to find what's going on. So if anything is positive, differ to angiography. In real life, the thing that's used to assess what you need to do is called the TIMI score, TIMI. I don't know how to calculate it. I never needed to learn so far. I'm gonna learn this year in my fourth year. Um, but yeah, that's it. So ask questions down in the description. I'll answer them. I'll promise I'll answer them. Yeah.